As House and Senate lawmakers continue to spar over whether the government-run health care option will work, our next guest has seen her state's government try its hand at universal coverage. Republican Congresswoman Marsha Blackburn from Tennessee is a member of the House Energy and Commerce Committee, and she joins us live from Nashville. Representative Blackburn, thanks for joining us. Now, what happened in Tennessee, and what did you learn from the experience?
In Tennessee, we have TennCare, and in 1994, this was the test case for public option health care. And what we learned very quickly is that a $2 billion program became an $8 billion program. It continued to eat up every new dollar of revenue that was coming into the state. We saw a tremendous amount of cost shifting take place, and you saw the rates, the insurance rates, the private insurance, go through the roof. You saw the cost go up in the state. We began to see our hospitals have problems with reimbursement rates. Our physicians and providers had problems with reimbursement rates, and as one physician said to me during the days we were working so diligently on the TennCare funding, the reimbursement rates were low and they came in slow, and that persisted throughout. We also saw what happened with TennCare, which was a gold-plated insurance program, the free insurance, the public option. We saw people that had private insurance move over to that public option insurance.
Right.
Indeed, 55% of those that moved on to the TennCare rolls were those that were uninsured. The other 45% of those that were migrating from private insurance onto the public rolls.
Well, it sounds like there were myriad problems, and it got very expensive. Now, the president's health care czar actually knows a lot about what happened in Tennessee, does she not?
Well, I would hope that she does, and my hope has been that the czar and that the Secretary of Health and Human Services, Secretary Sebelius, would be looking at TennCare for lessons learned because of the similarities between the program that is being offered now and the fact that TennCare was that first test case out of the gate, if you will, and that there are lessons that should have been learned from 1994 going forward on this program.
Right.
Indeed, we know that in order to bring the cost into a more manageable situation for the state, for the legislature who cannot tweak the program because it's a Medicaid delivery program, but who are charged with the cost, one of the things they've had to do is remove people from the rolls, because with our 800,000 Medicaid eligible in the state, the rolls, the enrollment into TennCare went to about 1.4 million.
Well, Representative Blackburn, we're going to have to leave it right there, but I think the lessons learned are we need to look very carefully about what we step off into.
Absolutely. We do not want the perils of TennCare to be forced on the nation.
All right.